Are you preparing for obstetrics exam? Let's complete a quick 5 obstetrics MCQs with answers and rationales. Question 1. A nurse is teaching a group of students about the bony pelvis. Which pelvic type is considered the most favorable for a vaginal delivery? A. Platypeloid, B. Android, C. Anthropoid, D. Gynecoid. Correct answer. D. Gynecoid. Rationale. The gynecoid pelvis is often referred to as the classic female pelvis and is found in approximately 50% of women. It is the most favorable for vaginal delivery because of its round or slightly oval shape, which provides ample room for the fetal head to rotate and pass through the birth canal with the least resistance. Clinical Pearl. For the licensure exam, remember, gynecoid equals go, good for delivery, while android equals avoid, often leads to surgical intervention, C-sections. Question 2. Which anatomical landmark is used to determine the station of the fetal presenting part during a vaginal exam? A. Iliac crest. B. Ischial spines. C. Sacral promontory. D. Symphysis pubis. Correct answer. B. Rationale. During a vaginal examination, the ischial spines are used as the primary reference point to determine fetal station. These are small, bony projections located on the inner walls of the true pelvis. When the leading edge of the fetal presenting part, usually the head, is at the same level as these spines, the fetus is at station 0. Clinical Pearl. Think of the ischial spines as the starting line of the mid-pelvis. Negative numbers, -1 to -5. The baby is still floating above the spines. Station 0. The baby's head is engaged. Positive numbers, +1 to +5. The baby is moving out toward delivery. Question 4. During a pelvic exam, the provider mentions the conjugate vera, true conjugate. The nurse knows this measurement is important because A. It is the largest diameter of the pelvic outlet. B. It represents the smallest anteroposterior diameter through which the fetus must pass. C. It determines the width of the subpubic angle. D. It measures the distance between the ischial tuberosities. Correct answer. B. Rationale. The conjugate vera, or true conjugate, is the most critical diameter of the pelvic inlet. It is the space between the upper margin of the symphysis pubis and the sacral promontory. Because it is the narrowest point the fetus must navigate to enter the true pelvis, it determines if the baby's head can successfully engage. Clinical Pearl. In clinical practice, we cannot measure the conjugate vera directly because the bladder and other tissues are in the way. Instead, providers measure the diagonal conjugate manually and then subtract 1.5 to 2 centimeters to estimate the true space available. Question 5. Which hormone is primarily responsible for the relaxation of the pelvic joints and symphysis pubis to facilitate childbirth? A. Estrogen, B. Progesterone, C. Relaxin, D. Oxytocin. Correct answer. C. Rationale. Relaxin is a hormone produced by the corpus luteum and the placenta during pregnancy. Its primary role is to soften the connective tissues, ligaments, and the symphysis pubis, the joint at the front of the pelvis. By making these structures more flexible, it allows the pelvis to give or expand during labor, making it easier for the baby to pass through the birth canal.